Did you know that combining everyday pain relievers like ibuprofen and aspirin could significantly increase your risk of serious stomach bleeding? Hello, I'm David from the Pharmacy Corner. I'm here to break down health topics in a clear, simple way with key facts and practical tips. Let's get started.
Today, we're talking about 5 dangerous over-the-counter medication combinations that could harm your health. These are common drugs you might have in your medicine cabinet, but mixing them can lead to serious issues like stomach bleeding, liver damage, or blood pressure spikes. We'll cover what each drug is used for, its common side effects, and precautions to take, especially focusing on these risky combos. Remember, optimizing your safety with over-the-counter medication interactions starts with awareness. First up, ibuprofen and aspirin. Ibuprofen is often used to relieve pain, reduce fever, and ease inflammation from things like headaches or muscle strains. Common side effects include stomach upset, heartburn, or nausea. As a precaution, take it with food to protect your stomach. Aspirin is similar. It's great for pain and fever relief, and low doses are sometimes used to help prevent heart attacks or strokes by thinning the blood. But it can cause side effects like easy bruising or stomach irritation. A key precaution is to avoid it if you have a history of ulcers. When you mix ibuprofen and aspirin, the risk of stomach bleeding goes up because both can irritate your digestive lining. According to the U.S. Food and Drug Administration, using them together may also reduce aspirin's heart protective benefits. If you need pain relief, talk to your doctor or pharmacist about safer options instead of combining these. Second, Tylenol, which is acetaminophen, and alcohol. Tylenol is a go-to for reducing fever and easing mild pain, like from colds or arthritis. At normal doses, side effects are rare, but overuse can strain your liver. Always stick to the recommended amount and avoid it if you have liver issues. Alcohol isn't a medication, but many people consume it socially. It can cause drowsiness, upset stomach, or long-term liver problems with heavy use. The precaution here is moderation. Combining Tylenol and alcohol is risky because both affect your liver, potentially leading to severe liver damage. The National Institutes of Health notes that even moderate alcohol use can heighten this risk when taking acetaminophen. If you're having a drink, skip the Tylenol and choose something else for pain. Third, decongestants and blood pressure medications. Decongestants, like those in cold remedies such as pseudoephedrine, help clear stuffy noses by shrinking swollen blood vessels. Common side effects include jitteriness, trouble sleeping, or a faster heartbeat. As a precaution, don't use them if you have heart conditions. Blood pressure medications are prescribed to keep your levels steady and protect your heart. They might cause dizziness or fatigue as side effects, and you should follow your doctor's instructions closely. Mixing decongestants with these can cause a sudden blood pressure spike, which is dangerous for your heart. The Centers for Disease Control and Prevention highlights how certain cold meds can interfere with blood pressure control. If you're on blood pressure treatment, opt for non-decongestant alternatives like saline sprays for congestion. Fourth, doubling up on antihistamines. Antihistamines treat allergy symptoms like sneezing, itching, or runny noses. Think drugs like diphenhydramine or loratadine. Side effects often include drowsiness, dry mouth, or dizziness. A big precaution is to avoid driving if they make you sleepy. Doubling up means taking 2 different antihistamines at once, which can lead to dangerous sedation, making you overly drowsy or incoordinated. This increases accident risks. Always check labels to ensure you're not overlapping similar ingredients. Fifth and finally, St. John's Wort and other medications. St. John's Wort is an herbal supplement used for mild mood support, like easing feelings of sadness. Common side effects include upset stomach, fatigue, or sensitivity to sunlight. Precautions include avoiding sun exposure and not using it if pregnant. The issue is it can interact with many drugs, reducing their effectiveness, things like birth control, antidepressants, or heart meds. The World Health Organization warns of these interactions, which can lead to breakthrough symptoms or treatment failure. If you're on any prescriptions, skip St. John's wort unless your doctor approves. To sum up, being mindful of these over-the-counter medication interactions, like dangerous drug combinations involving ibuprofen and aspirin or acetaminophen and alcohol, can help you stay safe. Always read labels, talk to your pharmacist, and consult your doctor about any concerns. This video is for educational purposes only, not medical advice or diagnosis. Always consult your healthcare provider before making health decisions.
Thanks for watching the Pharmacy Corner. David here. If this helped you understand your health, please subscribe for more clear tips. What health topic would you like next? Stay well.